welcome back to my channel. This is your fave nurse, and today we have Dorine with us today, and she's going to explain to you what she does on her everyday life, to explain her occupation, her old occupation, her new occupation, her current occupations, and all that fun stuff. Would you like to take over, Dorine?
Of course. Thank you so much, Anne. Hi, everyone. So yes, my name is Dorine LaFosse. And as Anne was saying, yes, my old occupation was a dental hygienist. I was a dental hygienist I am a dental hygienist still, but as far as it being my own career, I've been practicing for almost 7 years, and it'll be 7 years in October. Prior to that, I actually was a dental assistant for about 2 years, which was something that carried me through dental hygiene school. And we'll talk about that a little bit later, as far as like work and school balance. And now I have transitioned into the career of nursing, like your fave nurse Ann here. So now we're on the same team. But yes, I actually transitioned into nursing recently. I was so blessed to pass my NCLEX December that just passed. And now I'm starting a new career at NYU Langone in Long Island as a staff nurse. And I'm actually in my first week of orientation. But we'll talk about that a little later because we want to talk about dental hygiene here. So, Anne, do you have any specific questions that you want to ask? I don't want to ramble.
Of course, of course. You know me, I always have questions. The first question is, I think everyone would like to know, what is a dental hygienist? Like, what is your scope of practice? What's your obligations? Like, what do you do on every day?
Okay. So a dental hygienist is, and this is a definition that I'm saying for myself, but there's also definitions, like more technical online. But a dental hygienist is a dental professional that is helping in preventative care and education when it comes to dental health. Because a lot of times we see that, especially in young peers and in minorities or in underserved communities, we see that there's not a lot of education about why dentistry is important. So that is where the hygienist comes in. She's going to take you up under her wing. She's going to assess if you have any issues with gum disease, or if you have any issues with weak enamel, or anything that may put you in a higher susceptibility of getting a cavity or having a dental complication. So when you come into your dental appointment, you're going to be greeted by either a male or a female hygienist, and they are going to walk you in. And first, they're going to assess your mouth and make sure that there's nothing major that's going on. Then they're going to most likely take some radiographs, or we call them x-rays in layman's terms, and those are going to check for any issues that you may be having, whether you know about it or you don't know about it. And just a little side note, because I know with dental care, it's like if it doesn't hurt, it doesn't exist. And I just want to say that's not true. So I know it's hard to believe when the hygienist tells you, oh, you have gum disease, or, oh, you have a really big cavity. And it's like, well, it doesn't hurt, so I don't have that. But that's how dental health is. It sneaks up on you. So your hygienist wants the best for you as far as your oral care. So trust your hygienist, okay? But yes, we're going to also check your periodontal health. And that's something that we call probing, which is just a special instrument that we use to check measurements of your gum pockets to see what your health level is. And then we're going to provide a prophylaxis or a dental cleaning. And that is going to consist of some instruments that we use. A lot of people don't like the scraping sound, but sorry. And then we use an ultrasonic machine, which sprays a lot of water and gets rid of debris. And then we polish you. And then we discuss what we're going to do. And then we either see you in 6 months or in a shorter amount of time if you have other things that we need to address. But that is what we do in a nutshell. But I'm sure there are things that I'm missing, but that's a little summary.
No, that was great. I think it definitely got to the point on what you do. I think for those who, don't really know what it's like. I mean, sometimes you just see the body, but you don't really know the title. You're like, oh, this person in the room.
Because I've been called a nurse in the dental office. I've been called a dental assistant, and none of those titles it's not an offensive title, of course. But it's like a lot of people don't even know who the dental hygienist really is, you know? So I just wanted to give a breakdown of what the appointment is like. So then you can maybe be like, oh, that's my hygienist. Wow. Like, you
Mhm.
know, so yeah, great.
And then now bringing it back to like your personal journey, what led you to becoming a dental hygienist first? Like you.
Well, it's so funny. When I graduated high school, I was set on that I was going to be a lawyer. So I initially went to Nassau Community College for criminal justice, and I got my associates after that. And I was working at CVS, and I couldn't find any internships or anything because what do they always ask you for? Experience, right? So I was kind of like at an end where I was just like, "Ugh, okay, I need to find something else." And everyone always used to tell me, oh, you have such a nice smile. You should be a dentist. You have such a nice smile. And I'd be like, okay. So one day I'm on Google and I Googled like dental like programs or something, like short programs to be a dental assistant. And then I came across a program that was right around the corner from my house to get a certificate as a dental assistant. And I just went ahead and went for it. And then I took on my first job right in Garden City, New York. And after that, I just loved dental assisting. I loved being the support for patients. I loved, you know, the restorative process when dentists are, you know, filling cavities and things of that nature. And I always would get told, you are so good with the patients. You have a great chairside manner. You should pursue something further. And then that's when I was exposed to dental hygiene and actually doing the research about it. And then I applied to Farmingdale, I applied to Hostos in the Bronx, New York City Tech, and I was accepted actually into Briarcliff College, which was located in Patchogue, New York, which is in Suffolk County. They're now closed though. It actually got replaced by a beer company, which is so funny. But but that's really what led me into it. Dental assisting really exposed me to the dental environment and the atmosphere. And I just loved being that comfort for patients. And I just wanted to take it to the next level, honestly.
Wow, yeah, no, that's a great experience to go into.
Yeah,
You kind of figured out what you were good at versus, what you like to do and just combined it together.
right.
Um,
Hmm.
and then that's how you basically figure out, because I mean, it's something that I always tell people, you want to find something that you can see yourself doing because you're going to be there, you're going to be doing this majority of the hours within your lifespan. So
Yeah,
you want to
no,
make sure that
seriously.
you like it and you're good at it. You know what I mean? Because when you're good at something,
Yes,
it's like a confident booster. You're like, I got this.
of
But
course, of
also
course.
when you like it and when you love it, it's like a whole nother level of top notch.
It's another plus. It is. It is another plus. And
Yeah.
even with dental hygiene, even with me transitioning into another career, um, it's not to say that I don't still love it, you know. I will say that in any career, I do feel like there are little patches in your journey in a career where you do have a dislike for your career, or maybe you're not as happy in that moment in the career. But I do feel like it goes up and down. So for anyone that wants to pursue this career, there are going to be hygienists that say they hate it and they're over it and they want to get out. And there are going to be hygienists that say they felt that way too. And then they just moved into something else or into a different atmosphere. And then they found a new love for it, you know? So definitely take anyone else's experience with a grain of salt, because you can only have an experience for yourself, you know? So that's just one thing I just wanted to piggyback on.
Yeah, no, burnout, like, I mean, it's everywhere,
Oh,
like
yeah.
every field has, you're gonna have those people that like it, that love it, that hate it,
Yep.
it's just out there. I mean, some days are, I always tell people, I like being a nurse most days. Some
Yeah.
days are
Yeah.
more
It doesn't,
harder,
right?
you know what I
But
mean?
it doesn't mean you love it any less, you know? It's
Exactly.
just, it's the truth. Like,
And that's the truth. Sometimes I can just be really tired and it's just a lot,
yeah,
especially with everything with the world, the pandemic, all of that happening. It
absolutely.
was challenging, but it doesn't mean that I stopped loving it. It was just, you got burnt out, it
Yeah.
was just a
Yeah.
lot field. Um next question I wanted to ask is more specifically towards the schooling of being a dental hygienist. How was that like? Like, how were the classes? I know offline we were discussing how, every field you go into is challenging. But
Yes.
what type of hard was this hard? In other words.
Um, One thing is I live in Hempstead, which is in Nassau County. So that's the next county over from where Patchogue is located. So for me, I'll say my first challenge was commuting. And it seems like, oh, that has nothing to do with the experience, but commuting could definitely alter your experience in anything, a job, anything. So I had to drive over an hour, maybe an hour, 15 minutes or so every morning. I didn't have my own car. So my older sister would have to wake up and drop me off at like 5 in the morning, and I would sleep in the lobby until my 7 a.m. class. And, I would get out at 11 p.m. and then have to wait for my ride. It was a lot of that. And also it was hard finding patients. There were patients that were already patients prior to other graduating classes, but some of them didn't want to return because when you're in a dental hygiene clinic in a school, the appointments are very long and you have to come more than one time. So some people were happy to come for their family members or like their best friends, but for the next graduating class, I don't know you. So they're like, I don't owe you anything. I'm not coming back. So finding patients was difficult, but I would post things on Craigslist, on my Facebook page, on my Instagram. I would, walk up to people in the street. Um, and classmates that I had in different elective courses I was taking. And that was one way that I found patients. So if that is something that you've ever thought about, anyone that's watching, how am I going to get patients? Like, who's going to be the person sitting in my chair in school? That is something that, even if it seems impossible, and I'm telling you, I almost failed out of the program because I didn't not have enough patients, but it worked out. And I'm here standing here that letting you know that it will work out. So that's something that you shouldn't really worry about. Um, Other than that, it was a really great experience overall, but I think it's because of the women that I was in the program with. Um, I will say one difficult thing was I was the only African American woman in my class. There was another African American young lady, but she ended up dropping out of the program. So it ended up just being me. So I feel like it wasn't something that made me uncomfortable or anything. I don't want to make it seem like, oh, Briarcliff made me uncomfortable. Like, no. But anywhere where you're just the only person that looks a certain way, it can be a little intimidating in a way because you just feel like naturally you have to prove yourself. But just know that any room that you walk in, if you walked in that room and you work to get into that room, you deserve to be in that room. Okay. No matter what you may feel, even if the atmosphere doesn't put that feeling on you, but it's natural because with everything going on in the world, it's natural to feel out of place. But all in all, it was a great experience. I had great professors. And although it was stressful, what I got from it, the friendships I've gotten and the education I've gotten to lead me into this career, it's priceless. So there will be struggles, but you will make it through and you'll be so proud of yourself when you do.
No, that's amazing to hear. Also, too, I
Yeah.
wanted to add in, how is the work-life balance? Can you work while being in dental hygienist school, or do you not recommend that? Like, what is how?
Um, it's hard to say. It's not something that I would even say I would or wouldn't recommend, only because sometimes people don't have a choice, because we had so many different age groups in our class. Some of them were just out of high school, some of them already had other careers, some had families, and they were in their late 40s, early 50s. So I would say I personally didn't have a permanent job, but one great thing about being a dental assistant or just being in the dental field is they have agencies. And these temp agencies, they basically, you can call them or text them, letting them know, hey, I'm free around this time on this day. If you happen to have any work in this area at that time, please contact me, let me know. So for me, I would say if I'm in Patchogue and I have a 5 hour break between classes, instead of just sitting at the school, I would tell the agency I was available. And then I would work in an office in that location as an assistant. And I would do that here and there. Some of my classmates were, they were bartenders. Some of them were waitresses. Some of them had other jobs that they were doing, which I commend them But it's more than possible to have a job, but it's really just about how you manage your time. So I feel like when you look at the person that you are, when you decide, should I be working? Can I handle work in school? You'll know if that's a decision you should make or if you should just like lay low and just focus on your studies. So it really depends on you and what you can handle.
Perfect. Thank you for telling us a little bit about the school. Just because I think that's a huge factor before going into a program. We want to make sure, is this something that you're committed to doing, and something that you're
Yeah,
willing to do is putting that time, knowing the fact that it's any program. To piggyback off of that comment is just, sometimes I recommend not working first and then testing
yeah,
it out to see how you do as a student. And then
yep,
then I know I've mentioned in multiple videos that I preferred working while I was a student just because I'm a procrastinator.
yeah,
I will procrastinate if I have too much time in my hands.
yep, yep.
So I needed to work, so I didn't have that much time. And then the time that I had, I needed to get the things
I
done.
totally relate to that. Oh
Yeah.
my gosh, totally.
Yeah,
Yep.
exactly. So that is just me, but it's not everybody. Some people, they actually
Right.
need to like not work and focus in on their studying, which is super important because at the end of the day, you're paying money to do this program. You're paying
Yeah, and
out.
it was not cheap.
Exactly.
It was not cheap.
Yeah. And
So,
now
yeah.
the big question, moving on to like the money talk.
Yeah.
I think that is like one of the biggest thing when it comes to occupation. I think some people are just so shy to ask, like, how much
Yeah.
does this occupation make and stuff. But I think
Mhm.
this channel, we keep it straightforward. We want to know, we want to give you the right amount of money, just because like I think money is one of those things too, where you take out loans, so you want to make
Mhm. Mhm.
pay it back. And then B, you want to make sure you can be able to live off of the salary that you're gaining from.
Absolutely.
And of
Absolutely.
course, money can be, it can vary from state to state. There's no doubt about that, just depending on like
Mhm.
whether it's a costly state, whether it's less expensive. So my question for you is, what's the average salary for a dental hygienist?
So, I'm going to give you two answers. The first answer is going to be like overall nationwide. And then the second answer will be what my experience has been from when I graduated. So overall, when I looked it up, because I did look it up, there's statistics as far as from May of 2020 that states as far as the hourly rate, the in the low range, it could range from $26 to $31 an hour. And salary wise, that's going to be about 54,000 to 65,000 a year. And that's in the low range. Now, if we're going on the higher end of payment, which may be towards the city or a big city, wherever state you're in, it would be about $44 to $50. And that actually can go higher just based off of my experience. It can go up to $64 if you get lucky with certain offices. And that,
Max
oh, sorry.
$64 an hour.
Yeah,
Huh.
yeah,
Maybe I went to the
yeah.
wrong school.
Right, right.
I'm like,
So, and
oh, okay.
and that salary could be from 91K to 104K and up. And then in a median, we're talking about the $37 range, and that's about 77,000, 80,000. And that's like a median, like what most dental hygienists will come across. So for me, when I graduated, my first job was through a temp agency that I worked for as an assistant, and I was making $36 an hour. And on the weekends, like on Saturdays, I would make $39 an hour. And if I worked on a Sunday, I could make $41 an hour. And that was in the beginning of when I came out of dental hygiene school. Throughout that, I went to another job. It was about $38 an hour. And then my job in the pediatric office was about 40 in that range. And then when I really experienced making in the high 50s was through a temping app that is called Stint, and their pay rate does range. It depends on the office, but that is one app that I use that allowed me to see an hourly rate that high. So it's not like all the time, but it's possible to get that. But in the city, they pay very good. In New York City, they pay very well just because it's the city. So
That's amazing. And I
Mhm.
just want to like highlight too. So are we talking that type of money with an associate's degree, or are we talking about that type of money with a bachelor's degree, or it doesn't matter?
It doesn't make a difference, honestly.
Oh.
I actually have my bachelor's in dental hygiene. And when I had my associates, it wasn't even something that was even really asked about, because I decided to pursue my bachelor's while I was working in an office, but it didn't make a difference in my pay after I completed school. But what bachelor's degrees do provide you with are new experiences, because some dental hygienists love dentistry. They love talking about dental health, but they just don't want to do it in the clinical setting any longer. And that can take you to maybe becoming a professor or becoming a clinical instructor or even working for Crest or Colgate or something of that nature. So that just opens up different alleyways in the umbrella of the career like dentistry. So it's like I'm still a hygienist, but I can now do other things that doesn't only allow me to see patients in a clinical setting. So
Hmm, that's really interesting because it's
yeah.
okay, you can have a 2-year degree and still make 60K and a 60 an hour, which is wow. Yeah, I'm just like still in shock mode right now.
I'm sorry.
So I'm like, if I'm quiet, it's because I'm like doing a lot of self-evaluating right now.
Oh my. You are so funny.
I know. Like so that I'm like, I'm not the one to be quiet sometimes, but this really has me like just in here like, wow, and
It was like, really? Oh, okay.
this is why we needed a dental hygienist on the channel because
Yeah.
I knew y'all got paid. I just didn't know that it was like that.
Yeah, yeah, yeah. It definitely is and the great thing is there's a range. So it's like, the minimum is going to be in the 30s
Mhm.
in New York. But if it's in Georgia and it's in the 20s, but the pay like in Georgia is going to equal how much it costs to live.
Mhm.
And I don't know about now because a lot of people are moving to Georgia, so things are changing, but initially Georgia is not too bad as far as living costs. So the hourly rate is going to be lower, but it's going to be something that's still going to bring in enough income for you to live comfortably, you know.
Mhm. Yeah,
But
no.
I will make a disclaimer because it's easy to hear an hourly rate and think, wow, that is bomb. Like, I need to do that, which it's okay to feel that way. But from my experience, I'm 29 years old. I started, like I said, dental hygiene about 7 years ago almost. And I still live at home with my parents. It's still difficult sometimes to stay on top of bills, like even when I was working full time, because you have to think about taxes. When you're making a certain amount of money, they're taking more taxes from you, especially if you're single. And a lot of hygienists are young, they're in their early 20s. So you're single, you don't have dependents. So, not that I want to, like, pour like salt on an open wound and it's like, oh, I was all excited and now you're telling me this. But it's just being realistic because that sounds like a lot of money. But when you think about, does that job offer you insurance? Because after I turned 26, I didn't have insurance under my mom anymore. So that's my responsibility now. So you're paying out of pocket for certain things. Like, do they have something for security, like a 401k that they put in with you? If not, then if that's something that you care to, prepare for yourself for the future, that's something, again, you're going to be doing on the outside with your own money, with no one, adding in with you, because they don't offer that. Do they offer you paid time off? There are a lot of things that fluctuate as far as like pros and cons. I will say one of the things that drove me to go into nursing, aside from just wanting a career that challenged me a bit more clinically, was that I wanted job security and I wanted a job that I knew long term. I'm putting in this time, and if I decide to leave after a certain amount of time, there's going to be something waiting for me, that was set up through this career. And a lot of dental hygienists, that's hard because a lot of things aren't offered in a lot of offices. So um that's my experience with that.
Yeah, no, I can definitely add on to it. Working in a like an office or in a clinic, it doesn't give you that much of benefits. rather
Right.
than working in like a big hospital setting, like you would like being a nurse. And two, like, being being a dental hygienist, and you can probably speak more towards that. You're probably limited to like what you can do. As for nursing, there's so many specialties you can go into.
Hmm.
It's like actually overwhelming with all the specialties that are
Yeah, like
like I
dental hygiene is,
yeah. Hmm.
I'll be very honest. I do not see a lot of African American dental hygienists or dentists. For as long as I've been rotating in dentistry and temping, I've been exposed to a lot of offices. I'm in a different office every week. It could be two, three offices in a week. Um, and I don't see a lot of African American dentists, dental hygienists, dental assistants, and I know that it's true because when I do see one, it's like, oh, okay, and it's not to say either way like the people that I work with aren't great. It's just to say that in like as far as like being inclusive and as far as like people that look like us being exposed to this career choice, there's like a gap somewhere because it's like where are they they either don't know about it or they don't have the resources to really get in the door to figure out where to start in this field. So that's another reason why I really I'm grateful for your passion to get the information out to whoever is willing to listen because it's important. And walking into any office, it's comforting to see someone that you can see them and know that they maybe will understand your life, or they'll understand your struggles and what you may deal with on a societal level, because it really does get that deep. You can feel very uncomfortable in the care of someone that just doesn't understand where you come from or what you come from and why you may present the way you do when it comes to your dental health. So also being that comfort for anyone or someone in the office is another major plus with being in the field or in any field at that. When you said something about the percentage of Black dental hygiene or African American dental hygienists, there was recently a TikTok that I saw circulating that said it was about 4 to 8%. I might be mixing it up with nursing, but I'm pretty sure it's with dental
Hello.
hygiene. Yeah, it's
Hello.
low. Whether it's not that exact percentage, I know it's low. I know that because from my experience, I don't witness a lot of it from the places I've worked in. So
But yes, representation matters.
it
Especially
does.
yeah, I mean, I would love to see someone that looks like me, that talks like me, um, that's caring for me, you know what I mean? Then I
Yeah,
can feel more confident, I mean,
yeah,
sometimes opening your mouth is so vulnerable, you know what I mean? It's like you're really getting into my business right now. Like
yeah.
you're gonna see that
Some
I eat a
people
lot
are
of
really,
candy.
they're really scared. Like
Mhm.
I've had adults be scared, like they need nitrous because of their anxiety. And it could be from a dentist that shamed them a few years ago and they never came back. And now everything's 10 times worse and they feel embarrassed. But I will say one thing, it's never as far as with my intentions, it's never coming from a place of judgment or bashing or shunning you. It's more of like just wanting the best and understanding what dental health is and how it can affect you just generally, not just with your mouth, and understanding why it's important to educate who I can about why it's important to stay on top of it, whether it's getting your cleanings or taking care of cavities. I understand getting past obstacles like not trusting your provider or not feeling like there's a place for you in an office that you go to, or feeling limited because of insurance you may have, and only having certain offices as a choice. There's so many things that come into the barriers of people getting the access to the dental care that they really, really need. So it's so much more than not caring about your teeth. And I think that's another thing that people should be aware of, that some people want to make a dent in their dental health or in their overall health, and they really just are going through all these barriers that's keeping them from getting there. So you really have to have empathy when it comes to dealing with anyone in any medical healthcare scenario.
Yes, thank you. Thank you so much for giving
You're
us the
welcome.
rundown and like the pros and the cons. I think you added a lot of information for people to know. Like, and I love the fact that you kept it like honest and real. Like, you're like, hey,
Yeah.
this occupation is great, but there are some barriers and there are some limitations that you may face. And I like this topic and you being on here just because it's not always gonna be something, it's not, nothing is gonna be perfect, you
Right. Not
what
at all.
route you want to go into. And you just keeping it real and like, hey, like, yeah, we might make this much, but then you have to understand like the setting, also the specialties, being constricted in
Mhm.
one area, not challenging, you know what I mean? There's certain things that is important for you to know before going
Mhm.
into something. And I think that you definitely pinpoint all the key points into the in the dental hygienist occupation. The
Yeah.
last thing I wanted to just mention is,
Mhm.
or ask, is what advice would you give to people who are interested in this career path?
The advice I would give you is one, to be gentle with yourself because you're going to walk into some dental offices, especially if they're like corporate ran. So they have a high patient flow, or if it's someone that takes every insurance, they'll have a very high patient flow, and it can make you feel like you're not doing enough, or it can make you feel like you're falling short in your performance because you may run behind, or the dentist may, catch a little fit because you didn't take this x-ray when they asked you to, or you're going to have to pick up for one of your team members because they're stuck doing something. There's things that happen, throughout the field, but just know that you're doing the best that you can. And you just have to remind yourself of that even when it doesn't feel that way. That's one thing, because I've had my crying spells in the parking lot during lunch or before work just because I would have anxiety about my day. Because some weeks you'll have days back to back where just things just happen and you're like stressed out the entire day. And the reason why that happens is in the beginning of the day, if someone comes late, your entire schedule is going to be late. And it's like you either can take that with a grain of salt and do the best you can, or you can let it stress you out the entire day. And that can happen. So just be gentle with yourself. Know that you're doing your best. Always try to do research and educate yourself on the new things that are out there, because dental technology is always evolving on how to better treat patients, how to better prevent cavities, how to better prevent gum disease. So make sure you're staying on top of things like that so that you can bring new information into an office and make sure that they know that you're an asset. And just as much as they feel you should be blessed to be there, they should be just as grateful that you're there too, and putting in your best. So don't take offices abusing you, because that can happen in any field. Don't allow that. There's so many dental offices out there. There are going to be sometimes you have to go through a few to find the one that works for you, but don't let it deter you from looking for that. Don't be complacent. If there's an office that you're not happy in, do your best. Treat the patients the way you would want your family to be treated, but just have in the back of your mind that I need to find better for myself. Don't feel stuck to anything, in life at all, because we change every day. Everything in us changes every day. Our mindset, everything. So one day you might wake up and want something different, and that's okay. Um, and just enjoy it, have fun. Like when my patient comes in, they'll tell you I'm the singing hygienist. So I will be singing. Listen, if it's like when Summer Walker came out with her first little EP, most of them didn't even know who Summer Walker was. So I'm singing my little Summer Walker songs under my mask and just making it something so that I can really, really enjoy myself throughout my day, even if it wasn't going great. Get lost in it, enjoy it. Know that you're doing it for a purpose. Know that you're changing someone's life by bettering their oral health, and getting them onto a path to overall health. And just, keep reaching for the stars. If you want more, if you feel in your heart that, I want a little bit more, which is what happened with me, go for it. That's how I ended up as a registered nurse. I just said one day, you know what? I feel like I want something more. And that's okay. You can change your mind. And here I am today as a nurse and as a hygienist. And I'm so happy, and I'm excited for all of you who decide to pursue either career. Just know that you're going to be great, and it might be hard. You might have obstacles, but you will come out on top. You will come out victorious. And then you can share your testimony to whoever wants to listen, you know? So I wish you guys the best. Thank you for listening. Thank you, Anne, for having me. It was great.
No, thank you. Thank you for joining us. Thank you for just letting us know the two occupations that you're doing right now, which is amazing.
Thank
Letting us
you.
know all the information. And like I said, I definitely appreciate your honesty within the career, because this is something that is it's going to be someone's career path one day. If
Yep.
whoever's watching this is their stepping stone, and if I was looking into something, I would want to know like the details. I need to know like the pros and the cons as well. And I think that you did such a great job explaining both
Thank
sides.
you.
Just thank you. I can't even thank you enough. Being
Thank
on
you. You're awesome. And I'm so grateful that you reached out to me. I really, really am. So
yeah.
thank you for that. Because it could have been anyone else. There's so many hygienists on Instagram, you know?
Mhm.
So it just made me feel so good. Because
Oh,
sometimes I feel like no one's really watching when I post like my dental hygiene stuff. So I wouldn't say it's discouraging because it's for education, but it's just nice to see that, you know, it's reaching people. So
yes, perfect.
yeah.
Well, thank you for joining. Thank you
My
everyone for
pleasure.
watching.
Yeah, thank you, everyone.
Have a wonderful day. Please like, subscribe to the channel, and have a wonderful and blessed day. Bye, y'all.